To understand facial bones, you really need to understand the bones of the cranium. So if you look to the right, we just saw a skull come apart. There's the sphenoid, the keystone, and that sphenoid is going to show up in the facial bones. There's the lesser and greater wings. There it is from the posterior view. There's the wings. There's a superior view. You can see the sella turcica, that turkey saddle where the pituitary gland lies. Back to posterior view and anterior. Okay, remember that sphenoid. In front of that is the ethmoid, which has the cribriform plate, and there's the perpendicular plate. I'll be talking about deviated septum of the nose, and there's the crista galli, that attaches to the membranes of the brain, and the cribriform plate surrounding it. And that's important for the face because I'll be talking about sense of smell in the nasal cavity. And there you see where the brain's connection is with the nasal cavity. Palatine bones there. You can see there's perpendicular and horizontal plates. And those palatine bones form part of the nasal cavity. Right now you see the lacrimals in the orbits of the eyes. A close look at the lacrimal. There's a lacrimal fossa where a tear duct lies. And so there's our source of tears. There's the vomer. Now the vomer is going to be in the nasal cavity and it forms the bottom part of the septum. And the septum is what keeps your nose right and left side. I mentioned lacrimal bones, and it's about the size of your fingernail. And here it is right there. You can see the fossa there, where some of the tears are going to gather and pass to the nasal cavity. Palatine bones, we saw that on an anterior view. In the green right here are the palatine bones, which are separate from the other part of the palatine process of the maxilla here. Okay, very different, two different bones, even though it looks like one unit. I mentioned the palatine bones from the anterior view. Here's a perpendicular one, and there's a horizontal plate. And over on the far right, you'll see the structure again. Here's the palatine far in the back, and there's the palatine process of the maxilla bone here in orange. I know this is coming fast, and we'll try to tie it together little by little. Nasal bones. Okay, so don't get lost. I know this is a lot. Let's look at the nasal concha, because they're the ones that are going to swirl air around. There's the inferior, which is going to be low, far to the right. We have the middle, and we have the superior. Now, the inferior is separate from these two because it's involved with the sense of smell. Down here is the vomer, down at the base, and that's going to attach to the perpendicular plate. If I can get it shown, yeah, perpendicular plate here. All right, on the concha we mentioned. Different views. There's the inferior concha here again. That's a lateral view. This is the anterior view, another lateral view. We're trying to catch it from all angles because this is a tough part of anatomy, is getting all the bones in this facial part figured out. Maxilla, we think of the upper jaw, but it also forms part of the nasal cavity in the orbits. So the floor of the orbit up here, I'm on the far right here. Here you can see the small picture of a skull. So there's a maxilla, upper jaw. And you can see how it would form part of the orbit or eye, and also part of the nasal cavity. It has a central body with a maxillary sinus, so it's going to be mucus lined. And there's also velar processes down here where the teeth fit in these sockets or sulcus. Infraorbital foramen, far to the right again, and that's so that we have blood vessels and nerves passing to the surface, because we don't want our lips and our mouth numb unless we're getting dental work. Because think of hundreds of years ago, we're out in the forest somewhere and we're trying to eat something and there's bristles and bugs crawling on our face. Okay, we need to feel those things. All right, so there's a reason there. A palatine process. I mentioned this earlier. That is part of the maxilla, and you can see on the far right the This palatine process is the brown part, because there's the real palatine bone in yellow, but we're not talking about that. We're talking about the maxilla, which is here. And sometimes this process doesn't fuse properly, usually between about 12 to 18 months of age. It fuses, but if there's an improper fusion like we have below, then we have something called cleft palate. And it's it can affect, let me see, speech, frequent ear infections, and sometimes leads to hearing loss. Surgical correction needs to be done early in life, hopefully before the child starts to talk. Okay, and that's a bigger story than I can get into. We see it, and often multiple procedures are required. The temporal bone that has part of the zygomatic process, and it connects to the zygomatic bone. And here we have lots of muscles attaching for chewing. Below is the mandible. We have the curved body of the mandible, and then the angle, and then the rami is plural. There's two rami. I call them two ramuses. I don't know. That's just the way I am. And they're going to form into the mandibular condyle here, which is a major part of the temporal mandibular joint, the TMJ right here. Very important. And there's a cushion of cartilage there that may become inflamed. Temporalis muscles attached to the coronoid process up front. Now I'll show you a picture of that shortly. Mental foramen in front, very similar to the other foramen I talked about, where we have lots of blood vessels and nerves. And this and the mandibular foramen back here are two favorite sites for anesthetic injections by dentists. TMJ, I mentioned this, and there's a TMJ syndrome, and that's the symptoms are variable. Sometimes dull pain near the ear, if I could spell right. There we go. Tenderness in the jaw when chewing, clicking and popping, but not always. Okay, sometimes the clicking and popping sound is just the result of bones being pulled apart slightly, and there's fluid and there's cartilage, so you get a sucking sound. We hear it in the knees, we hear it in the hips. So clicking and popping is not always a sign of disease. In fact, many times it's not, unless there's pain associated with it. There may be headaches, tooth sensitivity, and abnormal tooth wear. And we see that, then we know this thing's pretty advanced. Many events can cause TMJ. Trauma, certainly, such as an accident or a sports injury, the head or neck. Grinding at night, called bruxism. Some people have, and they grind their teeth during the day as well. And improper tooth alignment. Now, so to treat TMJ, it's not just a blanket procedure. Okay, it depends on the cause of the TMJ. So if it's improper tooth alignment, then we're going to improve the occlusion of the maxilla with the mandible with orthodontics. Or if it's nighttime grinding, we might give them a mouthpiece that will ease some of the pressure on the TMJ, temporal mandibular joint. All right. Yeah, it's one of those things. Some people they develop the habit, and it starts off being pretty harmless, and that grinding goes on during the night, and they're not even aware of it. And they wake up, maybe their jaw's a little sore, and they don't know what's happening. All right. Nasal septum, a lot of words here, so we'll just kind of slow down and take it easy. That's going to divide the nasal cavity into right and left sides. So, and I mentioned this earlier, I like this picture of a real skull. There's a perpendicular plate, articulates with the vomer. If you remember, the vomer is kind of that, I don't know, wedge-shaped bone we saw in the preview. When there's a broken nose, it's usually not bone. It's usually the cartilage, the septal cartilage is damaged. And so I had this done. I wrestled in the university, and man, my nose got broken so badly so many times. It was a nightmare of a procedure. The cartilage removed, and don't I wish the results were this good, a straight nose. Mine, unfortunately, is still deviated. Okay, so when it heals, it's going to lean to one side, and I mentioned the vomer and septal cartilage. Partial blockage leads to frequent sinus infections, headaches, nosebleeds, and if you are ever in the hospital and you need to have a nasogastric tube, an NG tube, inserted through this area, if you have a deviated septum, prepare to. It's not fun. Okay, just trust me. Continue with the facial bones. Now, eventually, we're going to make sense out of this eye socket. We've been seeing it over and over. I think we can, and that's why I put a picture of the superior view. We have the frontal bone. We have the sphenoid, beautiful sphenoid. We have the ethmoid in the middle. And so now when we look at the eye socket, well, the eye is made of, well, the roof is made of frontal bone, right? See, look at this. The blue, that's frontal bone. That makes sense. And some sphenoid. There is the sphenoid. It's kind of greenish, and we know about that one. Not so hard. Lateral wall is of zygomatic, okay, and we know the cheekbone is orange here, so that's zygomatic. That kind of makes sense. And some sphenoid as well. Sphenoid gets involved in a lot of things because remember it's the keystone. The floor is maxilla, and right here, the yellow. A little bit of zygomatic here, makes sense. And a palatine way over on the edge. Where's the palatine? Okay, not much there. And finally, the medial wall, which is the middle wall, is of maxilla here, and lacrimal, which is that little, you know, the tear, fingernail shaped where the tear duct is, and a little bit of sphenoid action. There it is. Makes sense, huh? Okay. Might have to spend some time with that one. Facial features. Okay, paranasal sinuses. We ignore these guys when they're working, and then we curse them when we get a sinus infection called sinusitis. In infants and small children, they don't even have these, so they don't develop sinus infections until onset of puberty. Major sinuses: the frontal, ethmoid, sphenoid, maxillary, right there. Sinusitis. We got to keep that flow going, all right? So you got to think of a river of mucus flowing continually through the maxillary, the ethmoid, the sphenoid, and the frontal sinus. And we want to keep that going. Anytime it's blocked, then there's an opportunity for bacteria. So that's why we get a little inflammation there. We want to breathe some steam, maybe take a decongestant, and don't rush off for antibiotics yet, because all you got to do is reestablish that flow, that river of mucus, that lovely river of mucus that keeps the sinuses happy. Okay. Of course, hydration. Drink lots of water because mucus is mostly water. Facial features: fontanelle is dense connective tissue, and that's where and many mothers are thankful for that, because that allows the skull to shift and change shape during the passage through the birth canal. Anterior, good name. Anterolateral, also a good name. Posterior and posterolateral. They all kind of make sense. Okay, we use them to determine proper brain development and site for blood draws in that sagittal sinus. Okay, how do you tell the guys from the girls? Well, take a look at this diagram. Muscle attachments are probably the best, but all this information is kind of iffy because sometimes the males and females have similar features. Yeah, but here's some basic ideas: the supraorbital ridge, mental eminence, the glabella. These all tend to be pronounced in men. Finally, the hyoid bone. It's just a little U-shaped structure, but it can be damaged quite easily, along with the cartilage and bruising of some of the muscles in this region. And that's why autopsies often examine this region if there's any suspicion of strangulation.